Let's talk about the muscles who are present in the lateral compartment of my leg. So there is the first muscle which is located in the lateral compartment, and who's this muscle? This is my Fibularis Longus. Older books talk about this muscle with Peronis longus, but now this name has been replaced with the Fibularis longus muscle. So proximally from where this muscle is coming, head and the superior 2/3 of my lateral surface of the fibula bone. Remember, fibula bone is primarily made for muscle attachment, and tibia bone is primarily does the job of weight transmission. So this muscle, it descends laterally. When it comes down at the lower third, it becomes a tendon, and this tendon disappears in the sole of my foot. And let's see where it's been distally attached. It's attached to the base of my first metatarsal and the medial cuneiform bone. So these are the location. And this muscle we have talked about it. What is its main action? It's an everter, where at the subtalar joint, and it is also it establishes my lateral arch, and it is a dynamic support for my lateral arch of the foot. And this muscle is controlled by the superficial fibular nerve, which is a branch from my common fibular nerve. After this, now we are looking at another muscle, and this is my Fibularis brevis muscle. And this Fibularis brevis muscle, proximally you can see that it's coming from the fibula, but the lower portion, and then at the bottom it becomes a tendon, and it's to be attached at the base of my fifth digit. And this muscle, it's also an everter of my foot at subtalar joint, and this muscle is also innervated by superficial fibular nerve, a branch from common fibular nerve. So with this, the lateral compartment has only these two muscles. So now let's look at the nerves of the anterior and the lateral compartment of the leg. So here you can see, you are looking at, this is my common fibular nerve. When it comes down, look at it, here it becomes superficial, and this is what you're looking at, its deeper branch. The deeper branch, we learned that was going and supplying the muscles who are present in the anterior compartment of the leg. The muscles were tibialis anterior, extensor hallucis longus, and extensor digitorum, and its superficial branch, the superficial fibular nerve, controls my fibularis longus and brevis muscles. And now you can see in the same diagram a very critical point. If we have a fracture of the neck or the head of the fibula, this common fibular nerve is very prone for injury, and this injury might result in foot drop. And there are various factors. If we have excessive pressure at this point where we can roll over, we can feel this nerve going across the neck of my fibula. So if there is any compression, that will cause significant trauma, and the resultant outcome is the foot drop. Now this is the summary of the common fibular. From where it's coming from sciatic, superficial fibular, defibular, their course. I will not recommend going in a lot of details, but you should be knowing what are the muscles innervated by these different nerves, which have been mentioned within this table. Now this is the summary. We talk about these muscles, we look at their action, we know their nerve supply. They all look, blood supply. You remember we talk about popliteal, that was giving anterior and posterior tibial, and this is the fibular branch, and that is from posterior tibial artery. That is responsible to supply blood to the lateral compartment of my leg. And the muscles were Fibularis longus and brevis. So now we'll be talking about the posterior compartment of the leg muscle.